Hello, my name is Emily Cummings, and my pronouns are she, her. I'm the Regional Council Manager for Birth to 5 Illinois, Region 49, which covers Rock Island County. Thank you for watching Region 49's Early Childhood Regional Needs Assessment virtual report. This recorded session will provide an overview of findings from the Birth to 5 Illinois Region 49 Needs Assessment, as well as talk about the strengths, needs, and recommendations for improving access and enrollment in early childhood education and care programs in the region. A link to the full report can be found in the description below. If you'd like to turn on closed captioning, click the CC icon at the bottom of the video. This will turn on captions. If you want a language different than English, click on the gear icon for settings, click on subtitles, then auto translate, and you can scroll down to pick the language you want. Some Birth to 5 Illinois regions partnered with existing collaborations to complete the Regional Needs Assessment. Region 49 partnered with the Early Childhood Coalition, the region's long-established early childhood collaboration, to develop an action council that continues to support and expand upon the work already started in our region. We thank them for their partnership and continued support as we work together to improve outcomes for children and families throughout our region. In 2021, the Illinois Commission on Equitable Early Childhood Education and Care Funding issued a report with findings that highlighted the inequities in early childhood funding in Illinois and the need to create a better statewide infrastructure to support early childhood professionals, expand services and programs for families and caregivers, and increase enrollment in ECEC programs. The report focused on the importance of addressing racial inequities and the need to include local voices in the conversation funders and decision makers were having about early childhood education and care. To provide a structure for communities, families, and caregivers to engage with the data and share their experiences, a new statewide infrastructure was created across 39 regions, all of which align with existing Illinois State Board of Education Regional Office of Education boundaries, but operate independently. Birth to 5 Illinois regional boundaries align with school districts instead of strictly following county lines because many early childhood services are provided by or tied to school districts. Region 49 is located on the northwest side of the state with the mighty Mississippi bordering on its north and west sides. Region 49 is made up of Rock Island County, which is one part of the larger Quad Cities metropolitan area. This area is made up of 4 cities on the Illinois-Iowa border. It is the traditional home to the Sauk, Fox, Kickapoo, and Potawatomi nations. Joining me in the Region 49 office are Angelica Villarreal, our Family and Community Engagement Specialist, and our Administrative Support, Kelsey Swanson.
Hello, my name is Angelica Villarreal. My pronouns are she, her, and I'm the Family and Community Engagement Specialist for Region 49. The experiences and knowledge families, caregivers, and early childhood professionals gain while navigating the complexities of the state's early childhood education and care system are valuable. And understanding their lived experience in the local context is vital for decision makers to ensure communities have access to the programs, services, and supports they need. To this end, Birth to 5 Illinois was created to harness family and caregiver voices in early childhood education and care, and serve as a bridge between the communities and policymakers, so family, caregiver, and professional experiences can guide the decisions made to expand or enhance services across the state. We envision that our work will help all stakeholders reimagine a more equitable early childhood education and care system that respects family and community voice and works to ensure it is centered and prioritized at every level of decision making in Illinois. We have 3 main values and goals. First, we must prioritize family voice. Through this transformation centered on authentic family and community engagement, we will address the inequitable distribution of resources and services and rebuild our state's early childhood education and care system. Second, we must address the racial inequities that exist in our early childhood system. In an effort to move our early childhood education and care system to one where racism no longer impacts the child's success, We will work to dismantle barriers that have limited access to high-quality services for minoritized children in every corner of our state. Third, we will use the collective impact model to shift the current early childhood system to influence policy and funding at the local, regional, and state level. Birth to Five Illinois will use community-driven feedback to build a system that harnesses knowledge directly from families and providers and encourages decision makers to ensure new and/or expanded services are created to meet community needs. Two critical parts of the new statewide infrastructure are family councils and action councils. Located in each of the 39 regions, the councils provide feedback on quantitative data from the Illinois Early Childhood Asset Map and the Illinois Network of Child Care Resource and Referral Agencies to help contextualize this data at the local level. The councils meet twice a month in virtual, in-person, or hybrid meetings. The family councils are comprised of parents, caregivers from a wide variety of family types: single parents, adoptive and foster parents, caregivers of relatives, teen parents, two-parent families, multi-generational families, and more, and prioritize the voices of those who have not been involved in this type of work before. We want to highlight those who have been involved in our Region 49 Family Council over the past year and thank them for sharing their experiences with the early childhood system. Jasmine Cervantes, Natalie Doyle, Jess Lovera Matter, Jamie Nordling, Kristen Petrie, Abigail Pritchard, Antoine Smith Sr., Georgia Steer, Amanda Wentler. Action councils are comprised of early childhood education and care professionals, healthcare providers, faith leaders, elected officials, and other community members. Each Action Council reserved 2 seats for parents and caregivers to ensure family voices were included in every discussion. Action Council members were invited to bring additional aggregated data on programs and services provided by their agency or organization to complement data from ICAM and INCRA. We extend thanks and gratitude to our Region 49 Action Council members: April Berthum, Danon Bush, Beverly Clark, Andrea Flannery, Melissa Gravert, Janet Hill, Tess Hurt, Kate Jennings, Cindy Marr, Lindsay Meeker, Marcy Mendenhall, Tammy Muirhoff, James Richardson, Marcia Siebold, Michael Terry, Lisa Williams.
Hello, my name is Kelsey Swanson. My pronouns are she, her, and I am the Regional Administrative Support for Region 49. I will share how our team gathered data from our community. Beyond the council meetings, additional qualitative data was collected community-wide through focus groups and interviews, and all council members were invited to provide input on each section of their early childhood regional needs assessment. Council members developed the strengths, needs, and recommended next steps that are unique to each region. Regional teams, along with the support of their Action and Family Council members, created a dissemination plan and are holding community meetings virtually and in person to share their report's findings. The following slides highlight some data that was discussed by council members and provide insights into the early childhood education and care landscape in our region. Half of the children in Region 49 are living at 200% of the federal poverty level or less. Statewide, 39% of children are living at this same level. The median household income in 2020 was $55,980. A family that did not qualify for CCAP and was making that amount would spend almost 29% of their income on infant care. Rock Island County is the 14th most populated county out of the 102 counties that exist in Illinois. Region 49 serves as a refugee resettlement site, which is facilitated by World Relief. This makes Rock Island County altogether more diverse, with 77 different languages spoken in school districts across the region. Additional information about refugees, immigrants, and other priority populations was gathered through surveys interviews, and focus groups, and is included throughout our final Early Childhood Regional Needs Assessment report. Community collaborations are an integral part of the early childhood landscape. Local early childhood community collaborations bring together community agencies, organizations, and individuals with a shared vision or goal. They understand the importance of improving early childhood education and care for children, caregivers, and providers. Region 49 has two local early childhood collaborations, the Early Childhood Coalition and the All Our Kids Network. The Early Childhood Coalition was established in 2000, and since its inception, it has worked to identify community needs and cultivate resources. Throughout the years, the Early Childhood Coalition has brought training that has helped providers understand quality, partnered with the Regional Office of Education to establish Early Learning Quad Cities. This program ensures 500 more children receive publicly funded ECEC supports to become kindergarten ready. And most recently, it received a grant to start a campaign to recruit teachers to the field and start a mentoring program to promote job satisfaction and retainment. The All Our Kids Network, administered by Every Child, works to identify and plan strategic approaches to selected areas of high collaborative priority within the community. Some highlights of this collaboration include assisting with the implementation of IRIS, a referral platform, to our community, and providing training and toolkits to support early childhood mental health and early learning spaces. More information on the local collaboration and the work they're doing can be found within the Regional Needs Assessment. Next, you'll hear from Action Council member Lisa Williams.
The early childhood education and care landscape is made up of child care centers, family child care homes, and preschool programs, and is supplemented by publicly funded early childhood services. The financial structure of the current system is complex and often requires braiding of different revenue streams to keep programs in operation. Programs work hard to ensure that families don't feel the burden of the complexity of funding streams, but there's not a one-stop shop to understand eligibility for services. One parent shared she felt like she was navigating the whole system alone. Region 49 has Early Head Start, Prevention Initiative, and Healthy Families Illinois, all which provide home visitation services to expectant parents. When eligible children turn 3, they can attend Head Start, Preschool for All, and Preschool for All expansion programs. Not all programs are full day, nor do all provide transportation to and from the program. This is especially difficult for families that require wraparound services due to their work schedules. Families are choosing care based on trust, cost, and availability. Variables like location and languages spoken fall off the priority list when a family is desperate in finding childcare. One father lamented, "If you can't go to work, you can't provide for your family." There are 30 licensed child care centers with a total capacity of 2,332 slots. These centers vary between privately owned and not-for-profit. Not surprisingly, we see more child care centers located in areas that are the most populous. In Rock Island County, there are 119 licensed family child care sites that can serve up to 1,107 children. Over the last 3 years, available slots at family child care sites have decreased by 20%. These providers can offer more flexible scheduling than traditional care centers and may be more willing to accept children with medically specialized care needs. A drawback of family child care is that parents must arrange for other care options when a provider is sick or goes on vacation. One parent said, "My family child care provider closed for the 3rd time this year, and it's only February. Anywhere else costs $100 more per week, and I'm struggling." Through community meetings, focus groups, interviews, and surveys, Families in the region reiterated the urgent need for more affordable childcare and preschool options, staffed with providers and teachers that are well paid, supported, and who will want to continue in working in early childhood education long term. Similar to other areas of the state, Region 49 is experiencing a staff and a teacher shortage, preventing programs from operating at full capacity or being able to expand to meet community needs. Staff turnover is a big contributor to the workforce shortage, and it remains a concern among community members. Rock Island County is home to high schools, higher education institutions, and training programs that support those interested in starting or continuing a career in the ECEC field. Currently, there are over 150 individuals who are enrolled and are pursuing education in early childhood education. One administrator said, "Caring for children impacts how they feel about learning in the future. I don't think there's a more important job than what we do."
In speaking with families across the region, we heard repeatedly that navigating resources was difficult. One native Dari speaker said, "We need help in learning the language, going to school, and knowing how to pay our bills. We do not have any people explaining services to us. We cannot just call an office. They are not in our own language. If they do find us someone who speaks our language, they help us for a little bit, but then refer us to another place where the same thing happens all over." The greatest strength of Region 49 is its people. Rock Island County has strong, committed community partners and collaborations that come together to share resources and insight to meet the early childhood education and care needs of children and families. There are several programs that foster higher education opportunities for early childhood education and care professionals and prospective ECEC career seekers. We also have a variety of publicly funded ECEC programs, including Healthy Families, Prevention Initiative, and Early Head Start that do home visitation from birth to age 3. For children ages 3 through 5, we have multiple Preschool for All programs offered within school districts and community-based and Head Start sites. Region 49 also identified challenges and opportunities for growth in the region. These included families who need more accessible, affordable, and high-quality ECEC services, a community who needs a strong ECEC workforce, and provider and family input on policy change prior to those policies going into effect.
Hi, this is Emily, Regional Manager again. Based on community and council conversations, recommendations have been made on how early childhood education and care programs and services can be improved for families in the region. Recommendations will be presented to lawmakers, state agencies, local elected officials, and funders so that they can better understand the needs of families in the region. Our recommendations are as follows. 1. Optimize the early childhood education and care workforce by aligning wages and benefits with that of their K-12 teacher counterparts. 2. Streamline service coordination. There should be a one-stop shop where families can access all of the services that they need. 3. Data-informed action and advocacy. We need parents and providers to weigh in on problems in the system prior to law changes occurring. 4. Access to specialized supports. Navigating special needs, difficult behaviors, new parent support, and transportation are all critical areas that require specialized attention to ensure every child has equal access to high-quality early childhood education. Lastly, culturally responsive programming is crucial in early childhood education. It recognizes and values the diverse backgrounds and experiences of children and their families. This summer, we will be out in the community talking to more families, providers, and stakeholders about their experience with early childhood education and care. And we want to talk with you. We invite community members, families, and early childhood professionals to join the conversation by filling out a council interest form. Please go to www.birth-to-5il.com/councils or click the link in the description to get involved. Interest forms will close later this summer, with council meetings fully resuming in August. I want to thank our state partners for their support and for you for watching. Birth to 5 Illinois is proud to be a department of INCRA, and we're grateful for funding from the Illinois State Board of Education and the Illinois Department of Human Services. We encourage you to stay in touch with us by visiting our regional page at www.birth5il.com/region49. Join our Facebook group or reach out to me via email at ecummings@birth5il.com. Links to our pages along with my email address are available in the description below. Thank you for your time. We look forward to connecting with you soon.